I'm Circe Olson-Wessner, and I'm the director of the Museum of the American Military Family in Tijeras and New Mexico, and I'm part of the East Mountain Veteran and Family Collaborative. And I'd like to welcome you to our virtual roundtable today. Our theme is recovery and resources and self-care, and I'm joined by a few of my colleagues from different organizations, the Bernalillo County Department of Behavioral Health Services, the New Mexico VA, Forward Flag, and I'll let them introduce themselves on their programs. But we are in a pandemic, which is why we're doing our roundtable by virtual meeting. So I wanted to thank you all for taking time, and let's start a conversation. So why don't we introduce ourselves? So we'll start and do clockwise.
All right, so I'm Dr. Megan Kerouac. I'm a psychologist in the outpatient substance use disorder treatment program here at the New Mexico VA healthcare system. I'm excited to be here.
Thank you.
Hello, I'm Megan Aragon. I'm the clinical manager with the Department of Behavioral Health Services here in Bernalillo County. And we have various substance abuse programs here on our campus, so I'm excited to be here this morning.
Thank you, thank you. Welcome. And Melissa?
All right, good morning. My name is Melissa Andine. I work with Forward Flag. We're a nonprofit based out of Albuquerque whose primary mission is preventing veteran suicide. So oftentimes substance abuse kind of falls in line with that. So it's something very close to our heart. Glad to be here this morning.
Well, I'm glad to be here with you guys, and Evan, who is not pictured, is doing the recording. So thanks, Evan, for keeping us all technically going. So as I said before, we're in a pandemic and many programs and services may be unavailable. And some people may be concerned that they can't or shouldn't go in to get some help or treatment. And what are your organizations doing right now during this pandemic? Are you open for business as usual, or are you doing workarounds?
Yeah, here at the VA, we are open, not quite for business as usual. We've shifted to mostly doing any face-to-face stuff is all urgent or acute walk-in type things, with very few exceptions, like some of the injections that a lot of our veterans rely on for stability with relapse prevention or antipsychotic injections, things like that. But a lot of our treatments are still very much active, still going. We've just switched to doing those treatments via phone and video whenever possible. So absolutely, we are still taking new consults. We are still helping people who've been established in our clinic, and we're just doing the best we can with the technology that we have to try to be sure we're able to still provide that good quality care.
Okay.
The Department of Behavioral Health Services, the CARE campus, is largely running like business like usual, with the exception of various safety measures that have been put in place, which include everybody that comes into the building, staff and clients, must wash their hands before entering, and we have wash stations at the 2 access doors. Everyone has to wear a mask, including clients, and everyone's temperature is being checked, clients and staff, when they arrive. Clients, our detox is operating at capacity. We've had to do some reshuffling on our campus. We're pretty fortunate that we have a larger campus and we have space, so we were able to space out our detox so we could run at maximum capacity but still observe social distancing and have all the beds 6 feet apart. So we're running our detox program at capacity. Any individuals wanting to come in are medically screened before they come in, so their temperature is checked, all their vitals are checked. If they're displaying any COVID-like symptoms, then they are referred to UNMH. We, at this point, pretty much everyone has the ability to get tested. Test results are coming back a whole lot quicker, and as long as they're negative, then we are willing to take them in. Luckily, we started actually a lot of these practices of offering clients masks if they were coughing and sneezing, and checking temperatures regularly throughout the day on all of our clients well before this really became a pandemic in New Mexico. just for regular seasonal flu, because we are a communal setting. So I do feel like we were a little bit ahead of the curve in many aspects. Our long-term substance abuse program, our 6-month program, we are asking that individuals come from another environment where they are medically monitored for at least 14 days, where we can get a letter stating, you know, hey, they're coming from Turquoise Lodge or an inpatient VA program, and their temperatures have been checked for 14 days and they're displaying no symptoms at this time. And then we're working to directly transport them from that program to this program so that there's less risk of contact with public in general. So we are operating that program. It's taking, you know, we've slowed things down a little bit, but we are running it. And then our overnight program, our PIP program, which is our public inebriate intervention program, which is a harm reduction program that largely just seeks to keep individuals safe through the night, individuals that aren't necessarily looking to detox, but they need somewhere safe to be for the night and they'd like food. That program is running at a reduced capacity because that building, we only have enough to hold 10 people with observing social distancing. So that one is slightly reduced, but all of our programs are still up and running. And then of course we have our crisis stabilization unit, which anyone can access with a referral through a UNMH entity, regardless of substance use or not.
Okay, good to know. Good to know.
So ours is unfortunately we've had to really pull back on what our normal activities are. Typically we're a wellness center, and so we have a lot of activities where people come in to do art, therapeutic archery, a bunch of things that at this point there's not really a way to do it safely. I mean, the best that we've been able to adapt is to kind of switch everything to online. Once this has started happening, we started doing QPR as a evidence-based, internationally recognized suicide prevention curriculum. And so we've started offering those trainings. Now it's been one every couple of weeks online. We started out trying to keep it at like a 15-person capacity, but there was a lot of demand for it. So we're increasing every class to about 30 people. It's a really simplistic kind of approach to suicide prevention. It's about an hour and a half. It teaches you just kind of the language to use around it, what a conversation is going to look like, what the signs of somebody being suicidal is. So it's really just to kind of remove the stigma and make it to where it's a comfortable conversation for people to have. We also have a smart recovery meeting that we're just moving on to Zoom format tonight. So tonight will be the first time that we're able to offer that online. I'm excited to kind of see what that looks like. I'm already getting emails today inquiring what it's going to be like. So pretty pumped to be able to do that. And then the other thing we have is we have our 27-foot long travel trailer that we call the coffee bunker, that typically we would take around to rural parts of the state to kind of, you know, promote suicide prevention education, and also to clue veterans into kind of how to navigate the benefit system or what's available for them. And with the new Mission Act, we're trying to spread education about how they could access medical care closer to home. Now that we're trying to make sure that we're keeping everyone safe, including our staff, but also everybody in the rural parts of the state. We're changing that to be able to instead take supplies out. I know that we had a plan for, I think, coming up next week to go out to the Navajo Nation and take like diapers and disinfectant wipes and masks and all of the things that we could come up with that we're probably in need right now, to try to use our bunker in order to distribute supplies instead of just having it be kind of a coffee connection place for veterans. So that's what it looks like for us today.
So we're all trying to navigate around our pandemic here. And we are local to New Mexico, and you guys are all in New Mexico. But I imagine that a lot of these services can be found with a little detective work nationally. Dr. Kerouac, does every VA have a substance abuse program or resources right now for the veterans?
By and large, yes. It varies a little bit VA to VA what that looks like in terms of the size and the scope. This VA, we have both an outpatient and a residential arm that both focus a lot on working with veterans with substance use disorder diagnoses. Our residential units, I didn't speak to before, but it is very much pared down. That's true nationally for VA programs, since similar to Megan was talking about, since it is a residential thing, we've got to be very careful with COVID-19 and being sure that folks that we are having come in really need that high level of care absolutely can't do a lower level of care and are going to be safe in that residential environment. So the screening has changed a little bit, but that's still open for business. So we are nationally, as a VA system, still providing the residential and the outpatient substance use treatments.
So for somebody who's never sought VA help with substance abuse, how would a veteran who has now decided this is the time actually enroll in the program that you have or in their VA, wherever they are?
Absolutely. There's a national hotline to determine if you're eligible for VA care. That number is 1-877-222-8387. I'll repeat that one more time. It's 1-877-222-8387. And you just call and talk to someone on the phone to determine if you are eligible for VA care services. If you are local in New Mexico and you're already receiving services at the VA healthcare system here in Albuquerque or at a community-based outpatient clinic, a CBOC, you can talk to your provider there, whoever you see, about a consult referral to either outpatient or residential substance use treatment. And you make a good point that right now in particular, it's changing the way a lot of people are looking at their life and making some decisions about whether or not now is the right time for them to make some changes to substance use. One thing that is good to know for our clinic in Albuquerque is we are following a harm reduction model. It varies a little bit nationally, program to program. Some of the outpatient and residential centers are more harm reduction focused, some are more abstinence focused, but ours is harm reduction that includes abstinence goals, but that includes if you're just feeling like you'd like to be a little bit safer with your alcohol or other substance use. We do a lot of different things. So for any veterans who are in Albuquerque or are able to travel to Albuquerque for care, or do the remote phone or telehealth options, if you're on the fence and not sure if you are ready to stop using, you don't have to be ready to stop using. You just have to be ready to take a look at your substance use and look at your relationship with substances. And if you're not loving the way that relationship is going, that's what we're here for, is to find a better way for you to have a better, healthy relationship with substances, either in your life or not in your life. It's totally variable and independent and individualized here.
Thank you. So you are the Megan, you are the Bernalillo County Department of Behavioral Health Services. I imagine when I was doing some research about this program, I went onto the New Mexico Department of Health website. So I imagine that every state has a Department of Health. They could find a similar person in their state. But what are you guys doing? How do people get involved? How do they reach out to you? What's available?
We have a couple of different ways to get in contact with us. We have a wonderful individual, Evan, who manages a lot of our social media, a lot of the contact between our department and Bernalillo County as contact center. They have like a main contact center for any kind of county related questions, and then they divert the questions to the appropriate program. So we have those by those means. We also have a fantastic web page that people can access. And then there's also, you can call us directly at 505-468-1555. So again, 468-1555. And we can answer questions about our various programs here. I do know that outside of Bernalillo County, Bernalillo County is the largest county in New Mexico, but other counties do have programs. We're involved with meetings with other counties, and yes, every county, it looks different in terms of what they have to offer at this time, but most counties are trying to stay involved and still offer services. A lot of them have had to go to virtual, like a lot of programs have during this time, because there isn't a way to practice social distancing due to limited space in some counties and the size of their campus, but many of them still are offering services. So I always advise people, if you have internet access, just Google, substance abuse treatment in whatever city or county you're in and start calling numbers. And we get a lot of phone calls like that. People just say, I Googled detox centers. I Googled, transitional living, and that's how I found you all.
Mm-hmm. I know that Albuquerque, the city of Albuquerque, has a really nice informational line, and I'm sure they also can forward calls to different agencies. Okay, so Melissa, how do people get hold of you? What kind of, so right now, since you're all virtual, how would they ordinarily get plugged into your programs?
So ordinarily, I mean, we're just a wellness center that's open 9 to 5. People can drop in and check us out at any time. Now, because we've had to close the doors just to kind of make sure everyone stays safe, you can call and leave a voicemail message. We return it within 24 hours. We do have somebody that's going into the office constantly checking the messages. You can also contact us through the website, which is forwardflag.org. Or you can email info@forwardflag.org and somebody will return your email. So there is still ways to open those lines of communication. For the veterans that were kind of already plugged into our facility, we divided those veterans up between the staff when we had decided to close the office down. And so we're maintaining phone contact. What that looks like a lot of times is a lot of the veterans that have got involved with Forward Flag also are involved with the justice system, right? So they're either in the Metropolitan Veterans Court or the District Veterans Court. And so they have community service obligations and meeting obligations and things that they have to continue on even through this pandemic. They're not really laxing up the requirements for people who are on Veterans Court just because we're in the middle of a pandemic. And so that's something that we're trying to help kind of facilitate for those veterans, is if they have community service hours and they're not able to find another place to fulfill their requirement, we'll schedule a time where we can meet them there, come up with a project, everybody wear masks, take the temperature, go through the typical questionnaire that I think everybody is kind of seeing right now before they enter any establishment, and make sure that everyone stays safe, but also make sure that we're supporting them through this. Because I know that's a point of stress for a lot of veterans, that, you know, the consequence of not being able to meet these requirements is that you go to jail. And that's a place that nobody wants to be, especially during a pandemic, I would say. So we're doing our best to kind of try to make sure that we can make it as easy as possible. I know that I've gone in on the weekend a couple of times to be sure to meet veterans so that they can fulfill their hours if they're coming up on a deadline. I mean, I think that's, although like the virtual contact really does leave something to be desired, I think it still helps us to feel connected. You know, I'm a person in recovery, and I can say that that's something that is very important for me to stay in recovery. I can't, isolating in my house and not having a way to reach out to anybody or feel connected to anybody in any type of a way, that's a really dangerous place for, I think, most addicts to be. And so I'm grateful to be able to stay connected by phone, and I'm really excited to be able to do the virtual smart recovery meetings. I know that the 12-step meetings are the same. If you go to any of the 12-step websites, they've translated all their meetings onto kind of the Zoom format, so you can get connected in that way. So there's still a way to contact us. I mean, if there's a veteran that's in trouble or just wants somebody to talk to, I think there's also kind of a gift in this, and that there's a certain amount of there's a certain amount of anonymity to this. And so if somebody is having kind of, they haven't wanted to reach out to somebody face to face because it's a little overwhelming, or they have a little bit of shame, or whatever the reasons may be, this provides kind of an avenue to check out meetings or to check out an organization over the phone, and you're not really making that commitment where you're standing in front of somebody. You can kind of feel it out at a safe distance. So I think there is kind of a silver lining in this. It provides people an opportunity. And like Megan was saying, you know, if they're starting to kind of reevaluate their relationship with substances, this gives you kind of a safe path to do it and to reach out to other people.
Well, and it sounds like what you guys are all saying is that if you need help or you want help, you can get help now. It's not like don't go anywhere. So that's good. That's good. That is reassuring. So I was just going to say, you know, I've been, like I said, working, and I've been off kilter, you know. Many days I feel fine, and then there are days where I just feel off. I'm forgetful, I'm anxious, I'm worried. I read somewhere that this is grief. What can we do to make ourselves feel better during this time? Any one of you can answer that.
Yeah, I know for me, I do a lot personally and professionally of mindfulness. We have a mindfulness-based relapse prevention group here, both outpatient and in our residential programs. So I have been doing just a lot of mindfulness and just quick check-ins with how am I doing, because you're exactly right, just noticing a lot of wow, I'm feeling a little off today. Okay, just paying attention to that, and then figuring out other resources that are available to me, other tools that I've got. I'm very much a firm believer of you got to practice what you preach. So a lot of the coping skills and other evidence-based treatments that we provide here at the VA, we do because we believe in them, because we know they work, and a lot of us know that they work because we use them personally. So mindfulness is one example of what I've been doing to try to take care of myself in this difficult time.
Any other good suggestions? Or
I think staying active and taking advantage of the wonderful sunlight we got in New Mexico. I know that that's one thing that in particular has helped me, but also I'm encouraging with our clients, particularly in our long-term program. We already have daily physical activity built into the program, but luckily, fortunately, the weather has been nice lately. So we're really like, even if they just want to sit out on our lawn in a yoga mat, that's okay. Just go outside, even if it's for 10 minutes. Start walking the campus back and forth, because they're able to do that and observe all the social distancing. And most of them say, okay, fine, I'll go do it for 5 minutes. And the next thing you know, they're like, oh, the whole time period of 50 minutes went by and I feel a lot better. If it's a not so nice day, or they just don't feel like being outside, we can, respect that. And we offer them, things like chair yoga, online, like dance fitness, like Zumba type stuff. Again, if you have access to the internet, it is a very valuable resource, especially in a time like this, because there's very little you can't find on YouTube right now in terms of physical activity and staying active. So that's definitely been one thing that I have personally been utilizing, since I can't go to the gym right now. And I think that was one of the hardest things for me to adjust to early on in this whole situation, because that's one form of self-care for me. So again, like mentioned earlier, we got to practice what we preach. And so if I'm telling the clients to go out and be active, I got to do that and be accountable to that myself. Drinking water is really important, and acknowledging that it's okay to not have answers, and it's okay to one day be happy and then one day be anxious. And it's okay to be anxious about being home, but it's also okay if you're anxious and you're an essential employee and still reporting to work.
yeah.
It's okay. Just acknowledge your feelings. In like previously stated, just be mindful. Sometimes you just acknowledge it. If you're in a really bad mood, it's okay to just say, I'm in a bad mood today, and let other people know, so you get that space, rather than just, biting somebody's head off because we're not really in touch with our emotions. And then suddenly we're like, whoa, where did that come from? So we're really working through that with all of our clients, because it is this added time of stress. Another thing we've additionally done for all of our programs is limit the amount of news they can watch. We do want them to stay informed, but we noticed early on it was like a switch in kind of like an addictive behavior. It was like, I need to take in all the news. I need to know everything that's happening. And for most of them, it was skyrocketing anxiety, because one news report says this, one news report says that. And it's good to be informed, and it's good to know what's happening, but in doses. So we've limited the amount of news that they can watch.
Well, and I have self-limited too, because it's very distressing. I've been journaling a lot. I've been writing down how I feel. I've been writing down what's going on in the world. It's been very helpful. It's kind of like I'm documenting here and now, but yet I'm putting my own feelings in it. It's kind of calming me down. So Melissa, what do you recommend?
I mean, really along the same lines of everyone, I really like what Megan is saying. I think it is important to give yourself permission to feel whatever feelings you're having, and not to be too harsh on it. I mean, this is something that's very new to everybody who's alive right now. It's something that most of us haven't seen in our lifetime, and something that isn't, instead of kind of judging yourself harshly for not being able to adapt or for having those off days, like allow yourself to, because I think we're all going through it, and realizing that everybody is new to this, everybody is having their stress around it. I put up on the chat online, there's something called Apsara Balanced Health. That's the lady who does our yoga instruction at Forward Flag typically. And so she's doing 8-day challenges. So it'll be a Tuesday through Friday. You can go onto her website and find it. She's doing it whatever fee you feel like you can pay. If you can't afford to pay anything for the classes, then it's free to you. If you feel like there's value in it for you and you can afford to throw something in, there's a way to pay her for her services also. But I think that's a really important part of it, is doing the physical activity. You know, for me, it is really important to go outside, because now my house is everything to me. You know, I'm working out of my house. I'm lucky to have dogs, so they're kind of my motivation. I have to take them out a couple times a day, so they're good reminders to get out of the house. But I mean, really, mindfulness is the key to getting through anything, and just taking those moments to appreciate, taking those moments to allow yourself to feel what you're feeling. And I really like the journaling too, Circe, and listening to positive information. I mean, podcasts are incredible for me. That's like my go-to right now when I need a little bit of an escape and I don't want to turn the television on. I love listening to podcasts, so that's a good.
Well, so later on, when we post this, I'll put up a whole bunch of different websites and phone numbers and resources for people to look at, both nationally and local. Is there anything else that any of you would like to tell our viewers, or that you'd like them to know that I haven't asked about?
I think just take care of yourself. Just because one program maybe is not operating like they were or in a way you were used to, doesn't mean that there's not another resource that will help you. And if you don't know where to turn, ask for help. Ask your sponsor, ask a friend, ask a family member. We're fighting an epidemic in the middle of a pandemic with substance abuse, and that's what's really tough about it. And I think where national attention has been lacking, in that this is a very serious time for individuals with behavioral health issues. And it's not just the physical health of it. That's, we can't deny that. But the mental health toll, if you already have anxiety, if you already have depression, if you already feel like you don't have control of your substance use, you add a pandemic that none of us can control on top of that. So just do what you can control. If that means staying in your home and that's what you do to control your environment and your situation, do that. If exercising or calling your sponsor or whatever it is, if that helps your mindfulness, your state of mind, and your mental health right now, keep practicing it.
Mm. So somebody mentioned a warm line, and I know that Agora Crisis Center also has that, but what is a warm line and how can one access a warm line?
Yeah, the way I think about the warm line is a lot of people are familiar with crisis hotlines. So a lot of people won't call a hotline because they feel badly, like this isn't a big deal. I don't know why I'm spinning out about this. I don't need to burden other people with this. It's not a crisis. So if it's not a hot crisis, we feel like you just need someone to talk to. That's where the warm line comes in. So that's, I think, where the kind of the cutesy name comes in of not a hotline, but a warm line. We have one in this state. It's available. It's not 24 hours a day like the crisis hotline is, but it is 3:30 p.m. to 11:30 p.m. every day, trying to optimize the evening, which they know is typically harder for most people. And that number in New Mexico is 1-855-466-7100. So 1-855-466-7100. It's a nice thing. I've got a lot of, I know my veterans who've used it before because they feel like they don't want to talk to their friends or family about the concerns that they've got because they feel like they're going to be a burden to them by sharing those concerns, but holding it inside is not helpful either. So this is a nice alternative to feel like you just need to bounce some ideas off of somebody, otherwise you're going to spin out in your own head. So the warm line is a great resource.
Good to know. So anything else that I didn't cover or haven't asked that you'd like us to know about? I guess we're good. Well, I wanted just to thank you guys, the Megans and Melissa and Evan, for managing us. I think it's important to know during this time of such great, havoc, that there are people out there. The VA is still operating. Bernalillo County is open. You know, Forward Flag is keeping track of people and has people looking after each other. And of course, we all have to look after ourselves and our friends and our elderly neighbors. And so I think this was a really nice conversation that gives us a little bit of hope in a kind of frenzied way right now. So thank you for joining us, and I appreciate it. And again, this was a discussion between the VA healthcare system, Forward Flag, Bernalillo County Behavioral Health, and the East Mountain Veteran and Family Collaborative. So I wanted to thank you all today for joining us.
Thank you.
Thank you. It was really nice. Thanks.
Bye.